And with me in the studio now is Shirley Stewart, and Shirley is the clinical manager at Home Support. I have to start, welcome Shirley, first of all. I have to start by asking you, it's National Meatloaf Day. Do you make meatloaf?
I know how to make meatloaf. I didn't make any today, though.
You didn't bring it in. See, no, Diane doesn't have any.
She didn't tell us it was National Meatloaf Day.
Yeah, I didn't know that until we came on. Diane's daughter Elizabeth cooks meatloaf, but we don't have any this morning, unfortunately. So welcome, and you tell me what Home Support is all about. I ask these questions about. I can't never remember the difference between home support and home health. And I ask and I get the answers and then I forget. So I'm going to ask you again.
That's a very good question, and you're not the only one. We get asked that question all the time. Oftentimes when we get the phone calls that we get from family members and residents here, they are confused. But the easiest way to remember the difference between the two, certified home health, which is under resident life like we are, is Medicare driven. It is paid for by Medicare and regulated by Medicare, which, as you know, is a government agency and is specifically for those that are 62 or older are eligible. Home support services is private pay, total. We don't take any type of insurances, no Blue Cross, none of those things, nor Medicare. It is private pay. Those people that may have long-term care insurance may be able to get reimbursed for their charges, but we only accept private pay. So that's the major difference as far as remembering. What we also do differently is that we provide aid services, and we can provide that anywhere from 1 hour up to 24 hours per day, whereas with home health, they can only provide 1 hour at a time per day. So those are some of the major differences.
If I needed home support for 24 hours, I don't know if this is a fair question to ask or not. What would the cost come to?
It's not cheap. I have to be honest about it.
Yeah.
It is very expensive, but it depends upon, well, the cost is $22 an hour with our department. So you just multiply that out times 24. So no, it's not cheap at all. It is expensive, but what I've been told, it is still less expensive than if you were actually over in Garden Ridge, being there 24 hours a day. So, and the biggest reason why most people will choose to do 24 hours is so they can stay in their own home.
Sure. Yeah.
And they have their own furniture and things that they want right there in the home. That's the major reason that people hire us. They want to be independent. They want to be able to stay in their own home and be comfortable there. We will send an aide in, like I said, anywhere from 1 hour a day all the way up to 24 hours a day.
Sure. I have a, excuse me, I have a friend who was a medical aide. She's an independent contractor. She comes from outside. She was the medical assistant to the lady who lived in the apartment right next door to me. So we became friends, first of all. But then she became my aide when I went into the hospital. And I won't go anywhere without taking her with me. And now the charge, there's a flat charge for 24 hours. There's an hourly charge for something less than 24 hours, for 8 hours, for 12 hours, or something like that. Does it work the same way with home support?
Well, all of our fees are hourly based.
Yep.
So they do vary depending upon the length of time.
Sure.
If the shorter the time, the higher the cost would be.
Sure.
At present, we're $28 an hour for 1 hour,
Yeah,
up to
sure.
4 hours.
Oh.
Then it gradually decreases.
Yes.
And the lease amount is the $22 an hour for 24 hours.
Yeah.
I'm glad you brought up the private duty contracted aid. I'm very glad you brought that up, because I do want to speak a little bit about the difference between our department, Home Support, which is Green Spring based, and it is an Erickson Living department, versus outside aides, private duty aides, or other companies. You get the continuity of the entire community when you come with Home Support. here at Green Spring. We have access to all of your information, whether you go to the medical center, whether you go over to Garden Ridge for anything. We have access to all that information. We also have access, with your permission, of course, to the physicians and your outside physicians and any of the nurses or anything else that goes on here. We can assist you with dining situations and all of those things. We have that information.
Yep.
Also, our aides are bonded and insured. So if anything happens, then you know that you're going to have that coverage to take care of. Many, and they're licensed and they're trained, and they have to have no less than a year of experience. Then they come in to us and we give them more orientation and training before we actually let them go out into the community. So we are here on campus to be able to answer questions, to be able to troubleshoot, to be able to resolve any type of conflict. All you have to do is pick up the phone or take a little short walk down to our office down on the T level here in Village Square. So that's a major difference between hiring somebody from the outside, because if they're private, if they're their own private contractor, usually they don't have any kind of insurance. So if anything happens, then that's going to be on you.
Yeah, sure.
So those are some benefits that we do provide.
Yeah. How many on your staff, Shirley?
We have a large staff. We have approximately 175 aides that will provide services throughout the 24 hours at any time. And we have 9 nurses, 11 well, total of 11, because we have 3 clinical managers. I'm just one of them.
I see.
And we have 2 other clinical managers.
Okay.
And then we have 5 office staff.
Yeah.
So we're pretty big. We're getting close to 200.
Now, some of those people are probably part-time, are they?
We have full-time, part-time, and flex aides that work for us, and companions. And then we have all of our other staff, our office staff are all full-time. We have 3 full-time nurses, 1 part-time nurse, and then we have 6 flex nurses that work for us. So the majority of our staff are full and part-time employees.
Yeah. Now, Shirley, I think, excuse me, you've been here a couple of years, I guess. You go back to Nancy J., I think.
Yes.
And, but I don't recall, what is your background? Where did you come from before you came to Green Spring?
Well, I am a registered nurse.
Yes.
And I have a varied background. I have worked in acute care. Oncology was my acute care experience from St. Louis, Missouri.
Really? Yes.
And I've been here in Virginia for about 4 years. And I also have pharmaceutical sales experience. I worked for a pharmaceutical company for almost 20 years. And I've also been into long-term care. I was a branch director in St. Louis for another private duty company. So I do have a varied background.
Yeah. We're down to a couple of minutes here. My wife ran up a sizable bill, and I never did apply for reimbursement from my long-term care. I thought, I hate paperwork, and I thought, oh, this is going to be complicated. There should be help somewhere in Green Spring when it comes to trying to recover some of your costs. Probably social workers, probably.
That would be the first place that I would go to as far as assistant with how to maneuver the paperwork.
Sure.
We can provide the information about your care, how much care you received from the aides, and the days that they were done. We can provide that information, and we do provide that information as a courtesy to your long-term care company. So we can provide that information, and then they will take that information and decide what your reimbursement is or what it will be. But as far as filling out the paperwork and doing those type of things, I would say that maybe the social service department would be your best resource.
Sure. Okay. Shirley, we're running out of time here.
Sure.
I thank you so much for coming, and I'm sure I'll see you back in here in the studios. We do have some announcements. Green Spring feature programming